Hi, I'm Dr.Gerald Deas from Health Center, from Downstate Medical Center. Can you hear me? I know you can hear me. If I do it like, you know how people used to do this to get a kind of a hearing, if they had a hearing problem. They didn't have these fandangles things. You can put little tiny things in there. It can make you hear now. And that's what we're going to discuss today. If you are hard of hearing, if you can only see this picture but not hearing it well, it might be good to have your ears checked, and you might need something to, years ago people used to take their finger like that, and they used to do this, and you can hear. Actually, I did it myself, and you can hear better. I don't know if you're shaking up the wax in the ear or what's having you, but there's something going on when you shake that eardrum, which is controlled by little ossicles in the back of it and things like little bones and things like this. They get hardened sometimes. When it gets hardened, it's not going to vibrate and send a message back to the brain so you can hear and things like this. So get your shoes off, get comfortable, because we're going to discuss hearing today. And hopefully many of you sitting out there might be surprised at the things that are used today to let you go to the theater, let you go to parties, let you go like this to hear somebody, or you can't go to a concert, but if you had these one little tiny thing that you can put in your ear, you could hear better. So I want to welcome you, John. Well, again,
thanks, Dr.
Thank
Deas.
you so much for being today, because knowing you all these years, and you look like you haven't aged. I don't know what.
Trying to be like you.
No, I think it's your haircut.
Maybe.
Because it makes you, we all look younger when we have haircuts. But hearing is an important thing as we go along. People have no idea when they see people in the street, even on drills, with the noise that's going through,
right,
or all the eccentric noises all around us today that are dulling our hearing, doing an effect on our little bones. So maybe you'll get into the anatomy of the ear and then how you might be able to help them to hear better.
Sure. So we can start there. Just so people at home know, I've been a licensed audiologist since 1998.
Right.
And I've been here since the year 2000. And since that time, in the beginning we had just a handful of patients. Right. And since that time, we've developed a database of about 25,000 patients that we've seen over the years.
Isn't that wonderful?
And when we can help someone hear better, they feel more like themselves.
Oh, yeah.
And it really becomes a very rewarding reason to wake up early and stay late.
Oh, yes.
I have a joke with my wife. I tell her I'm going to work a half a day. You know how many hours are in a day, right? 24 hours.
That's right.
So a half a day is 12 hours. So,
well, it's interesting also with that thought process going on there, but when you think about people living longer, everything wears out. I mean, I don't care who you are, a percentage of people are going to wear out,
Sure.
you know, just like you wear your shoes out and everything, your eyes. I don't even think you wear your eyes out, because right now, and even in ophthalmology, they're thinking that to put glasses on children too early doesn't allow the eye to develop.
Okay.
With the muscles and everything and so forth. So you might be making those things lazy.
Okay.
And then when you finally got a good developed eye, it doesn't move the way you want it to move. But let's get into hearing.
Sure. You mentioned the anatomy. I brought a nice illustration that we have of the structure of the hearing system. So I hope I'm holding it well. When we think of hearing, we think of two ears, okay, a right ear and a left ear. The way the system works is that sound comes into the ear canal. It pushes on the eardrum vibrates, and then the three little bones in the middle ear vibrate as well. Okay, these are the three smallest bones in the body. They're called the ossicles.
Right, yes.
And their names are the malleus, the incus, and the stapes. When they vibrate, they create a chain reaction that sends a fluid pressure wave into the cochlea.
That's really something.
The cochlea is the organ of hearing. It's shaped like a snail shell.
Yes.
Okay. Inside the cochlea, you have these hair cells that basically are your receptor cells.
Wow, okay.
And they vibrate and bend in response to the incoming sound.
That's wonderful, yeah.
When we're hearing well, the hair cells look like this.
Right.
When the hearing is reduced, oftentimes it's because the hair cells are not working as well.
I see.
If we could look in and see them, they would have a worn out appearance.
Oh, okay.
Okay.
What do you mean constant noise and things like this that's not natural can actually wear them out?
Well, there can be a lot of reasons.
Okay.
Diabetes, genetics,
Okay.
getting older, noise exposure,
Sure.
high blood pressure, certain medications can all lead to reduced hearing.
That's really interesting. When you say diabetes, so many folks in our thing have diabetes today.
Definitely.
What percentage do you think have hearing problems?
Well, I know in my population we work pretty closely with the diabetic clinic.
Okay.
And a number that I heard recently is about 25% of people with diabetes are more prone to developing some type of hearing loss.
That's interesting.
And what many people don't realize is that the brain is really the most important part of the hearing system.
Oh, okay.
Okay, and the information from the right ear is primarily processed in the left side of the brain, and then the information from the left ear is primarily processed in the right side of the brain.
I see.
Okay, so this is how we were designed from the manufacturer.
Right, okay.
And if there's a reduction in hearing, it can affect how the brain is functioning over time. Okay, if it's me, if my hearing is reduced, then there's what's known as a redistribution of cognitive resources. Okay, so that's a fancy way of saying that my brain has to work overtime to hear, so that maybe there's less energy for me to remember or to focus on other things.
So even folks like with Alzheimer's and things like this.
Right. There's a big connection between the onset of mild cognitive impairment or even Alzheimer's and hearing loss.
Oh, okay.
One of the studies that's quoted frequently is the Baltimore longitudinal study from Johns Hopkins. The main author was Dr. Frank Lin, and he did a longitudinal study where he looked at folks over a period of a decade or more. He did assessments of their hearing and also assessment of their cognitive status. And he found that for the people whose hearing declined more quickly, their brains were aging more quickly in terms of their cognitive functioning.
That's interesting.
Yeah.
That's interesting. You know, now when you see these children walking down the street now with the earplugs in their ears,
Right.
what percentage do you think of those children ultimately might have hearing problem?
Well, I hope none, but hope
Right.
hope is hope.
But I mean,
we
do
don't,
you think a possibility that it
of
could
course,
affect it?
Sure. I mean, if we're overdriving the hearing system, there's always risk for damage.
Right.
I went to a conference recently, and the speaker actually presented us with a question that got everybody thinking. And it was this particular speaker dealt a lot with musicians. So he talked about how he works with musicians to help them protect their hearing.
Okay.
So he gave us a multiple choice question.
I see.
So he said, which type of instrument do we think is the hardest to protect hearing from? So would it be a percussion instrument like a drum? Would it be a string instrument like a violin?
Right.
Or a wind instrument like a saxophone?
Right.
So, want to take a guess at that?
That would do what?
Okay, so which can be potentially more harmful to the
Harmful?
hearing and more difficult, let's say, for someone like myself or a sound engineer to protect hearing?
Yeah. Well, I would think there's something that would have a force behind it to be more damaging than something more soothing. I would say drum.
That was my answer also.
We're wrong.
Right, okay. So what he explained is that because the wind instrument is physically connected to you,
Yeah.
right? You're
Right.
blowing, let's say, into a
Oh, yeah, right.
saxophone.
Yes.
You're getting a lot of that sound back through vibration in the bone,
I
through
see.
bone conduction. And no amount of hearing protection or earplugs can protect you from that.
That's interesting.
Okay.
Yeah, well, now that should be taught in all these schools of music.
Yeah.
You know, if you want to enjoy your hearing later
Right.
on in life,
Yep.
you better protect it in some way.
Sure. I mean,
But if you love music and that's your instrument that's doing it and so forth, it's
Yeah.
hard to tell people, hey, quiet it down. Do you think that playing it less would have the same effect if they did it all the time?
well,
like
probably,
you know,
playing it responsibly.
irresponsible.
You know, and maybe getting a hearing checkup once a year just to monitor your baseline and know if there's any changes.
Right.
You know, I mean,
That's interesting.
you gave the example of a jackhammer, and I mean, those guys running these jackhammers in the streets.
Yeah.
A lot of their hearing damage is coming through vibration.
Right.
You know, so
Right.
certainly they should protect the hearing with the earplugs and the earmuffs, but there's a lot of that input that can't be made less or attenuated.
That's really interesting.
Yeah.
Yes. Well, what can we do now? You come to you, you do. Let's start off. What do you do?
What's
or
the
your
process?
staff? Yes.
Okay, great. So, as audiologists, okay, myself and my team, our scope of practice is the non-medical diagnosis and treatment of hearing and balance problems.
I see.
Okay, when we say non-medical, that just means that we don't write prescriptions
Right.
or perform surgery.
Right.
Okay, we are on the same team with the physicians that do that. So they do their part, we do ours.
Right.
If you were coming to me as a patient, we would take a detailed clinical history.
I see.
Okay, we'd want to know what was your motivation for coming in, what are your health issues, what's your family history, what are your
Okay.
concerns, what are your goals.
All right.
Okay, we'd take a look in the ear. We would do a pressure test that measures the function of the middle ear. That's the space behind the eardrum.
Right, yeah.
Okay, and that could identify any fluid or congestion that might be there.
Right.
After that, we'll do a hearing test with the earphones. We will test your hearing acuity for a number of different frequencies. Frequencies are like the keys on the piano.
Right.
And then we'll also test your ability to understand words
Okay.
at a comfortable listening level.
Right.
And we'll compare it to the normal range of hearing.
Right.
If you're normal, great. If the hearing is showing a sign of being reduced, then we'll talk about any appropriate next steps.
Okay.
If it can be treated medically, okay, then medication or surgery might be the answer. If it can't, then we'll be talking about some type of assistive technology. Most commonly, that's hearing aids.
Well, how about conditions, medical conditions such as diabetes? Or, do a certain proportion of diabetics have a hearing loss?
What I've been seeing, it's about 25%.
They have a hearing
About
loss. You think
25%.
due to the diabetes?
It's a risk factor. It's hard to know causation, in
Right.
a concrete way, but the studies show that people that have diabetes, they're more prone to different neuropathies, right? Like they have problems generally with their fingers, their toes, their extremities.
Right, surely.
And the small blood vessels within the hearing system, within the organ of hearing, can be at risk as well.
Right. What about boxing?
Trauma.
Yeah, trauma, like
So guys getting hit in the head.
hitting the head, like, yeah.
Yeah, certainly what could happen is any form of head trauma can disrupt the structure within the middle ear.
Well,
Okay,
yeah,
those are those three little bones.
Right.
So,
Oh, yes.
I might see, I've been doing this for a long time, but I might see 1 or 2 cases a year of traumatic hearing loss.
Oh, I see,
And I don't know
okay.
if we've met too many boxers, but it's usually, car accidents or
Yes, right.
someone having a bad fall.
Surely.
But the structures of the ear are encased in petrous bone, very, very hard bone. So
I
they're
see.
pretty well protected.
Right. Years ago, when they didn't have penicillin, there was what they would get tonsillitis, and then there was a condition known as mastoiditis, and they used to have it right behind here, and they used to have a lot of operations back
Right.
there.
Yeah, the air cells within the mastoid bone, which, as you pointed out, is back here behind the ear, they can become infected, and as you pointed out, it was much more common years ago, this mastoiditis.
Yes.
And I've met a number of patients who they're probably retirement age now,
Yes.
but they had the mastoid surgery
Years
done
ago.
years and years ago,
Yes.
right?
Was it appropriate to do the surgery?
At that time, of course.
Yes,
Yeah,
all
of course it was, but it's done very seldom now.
Okay. All right, let's continue.
Yep. Okay, so I brought some devices to show you. The hearing aids come in different sizes.
Okay.
When I started working with hearing aids about 15 or 17 years ago, most of the hearing aids you could see from across the street.
That's right, sure.
Okay, but nowadays they've gotten pretty small. Okay, I'll hold one in my hand. I'm not sure if the camera can see it. Okay, I have this one, will fit my left ear, and it really kind of just fits like a deep earplug.
Oh, yes.
Okay, and it just goes right in like that.
Right.
Okay, that's the sexy one. Okay, it is very, very discreet. There are other types that fit over the ear.
Yes, right.
Okay, this one's set up to fit my right ear. So there's a piece behind the ear, and then there's a little wire that goes inside. Most people can do well with either type.
Yes,
Okay,
right.
depending on the configuration of their hearing, we may recommend one over the other.
Okay.
Okay, but either solution would provide a significant improvement in hearing,
Oh, yeah.
benefits the quality of life, and then also be discreet.
And when you talk about the quality of life, you know, folks usually do what the body says do. If they can't hear, they'll say, well, that's just getting old, you
Right.
know? And this is such a false sense in our society, the things to say it's just getting old.
Sure, sure.
It might be quite healthy to be able to be fixed.
Yes, of course, of course. Look, if your heart rate was diminished, you'd get a pacemaker.
Yeah, sure.
You wouldn't say that it's just a sign of getting older.
Right.
So
right.
if your hearing is reduced, you need a hearing aid.
And how
Okay,
about glasses?
Or glasses,
You
right?
know?
I mean, just like if you have a broken arm,
Sure.
you don't think about getting a cast, you need to do it.
Yeah, surely.
And one of the things that we do when we interview patients is we look at how their loss of hearing or reduction in hearing is affecting their quality of life.
I see.
And then we come up with goals. You know, so someone may say to me, you know, I have a real hard time hearing my family when I'm at home.
Right.
And we'll ask, well, what's that like for you? What happens then? They may say that, you know, they feel frustrated or they feel left out.
Right.
And then we'll ask them, what would it be like for you if we could make that problem less, if we could help you hear your family? And hopefully they'll say, you know, that would be great.
Yes.
And we kind of focus them on like these 3 listening goals, and then those are the goals that we look for and measure the outcomes of treatment.
Okay, fine. Yeah. Now, any newer things that you?
One other thing I brought to show you is something called a cochlear implant.
Okay.
Okay, a cochlear implant is really the hearing solution of last resort. Okay, so if someone has hearing loss in the severe to profound level,
Yes.
they're really not benefiting from even the best hearing aids, then they
Right.
might be a candidate for a cochlear implant.
I see.
Okay,
I see.
a cochlear implant is a surgical solution. Okay, there's an electrode that is actually implanted into the organ of hearing.
I see.
Okay, that's
Yes.
done during a surgery that takes several hours. Okay, and it is something that we do here.
Right.
After this is what the electrode looks like, by the way. Okay, so these would be the stems of the electrode. They would go right inside the organ of hearing, and then this is the stimulator, and it basically gets implanted under the skin about here.
I see.
Okay, so everything that I'm holding in my hand is not seen
I see.
after the surgery. This is
see.
inside.
I see.
Okay,
I
it
see.
takes, typically for most patients, it takes them about a month to heal.
Right.
After that, they come back for what we call their activation or their initial
I see.
stimulation. At that point, we provide them with a speech processor, which is this. It attaches to a headpiece.
I see.
The headpiece has a magnet in it,
I see.
and it will stick right on the skin just like that.
Okay.
Okay, so they can
Yeah.
take it off when they need to take a shower.
Yeah.
They can take it off. What happens is there are microphones within the processor. They pick up sounds from the environment, and they convert this acoustic information to an electrical signal.
I see.
And that's transmitted across the wire, across the headpiece, and to the internal component.
I see.
Okay, so the person is hearing basically through direct stimulation of the organ of hearing and the nerve of hearing.
Right. Well, I had a niece, you know, she was born deaf. You know, at least they picked it up
Okay.
very early. Are any of these instruments that you're using here helping those children?
Okay, great question. So the best candidates for an implant
Yes.
are little babies that are identified when they're very young.
Yes.
Okay, because their brains are still in this plastic mode where they can be
Right.
molded and shaped to learn new things.
Surely.
Okay. Another good candidate is someone who is already in the hearing world.
Right.
Okay, let's say it's me. I hope it's not me, but if it's me,
Right.
and I lose my hearing due to meningitis.
Okay.
Okay, I'm a
Sure.
good candidate for this because I'm already relying on hearing and speaking. If you have a 35-year-old person who's been deaf for their whole life
Right.
and communicates by sign language,
Right.
they're not really a good candidate for an
Okay.
implant.
All
It will
right.
give them some environmental awareness,
Yes, right.
but they're not in our community as far as speaking and hearing. They're probably in what's known as the deaf community.
I see. Do animals different than human being? Animals, you know, so many animals. you see the ears picker.
Yes,
like
yes.
that. They're hearing something coming down
Right.
the line, you know, and they can get out of your way real
Yes,
quick. You
yes.
know?
It's a great question. You know, this past weekend, I took my wife and my children. We went to the Museum of Natural History.
Okay, yeah. Okay.
And we saw an exhibition, and one of the films that we saw, they talked about the hearing of bats.
Oh, yeah.
And they said that bats can hear like 5 times better than we can. You know,
Right,
and they
yeah.
have, because they travel in the dark,
Yeah.
and they're primarily doing it on echolocation.
Oh, okay.
Right? So
Bouncing off.
they're using,
Yeah.
they're producing sounds, and then they're getting the echoes of the sounds coming back, and that gives them their orientation in space.
You know, they. I've seen some African films of elephants corresponding with one another.
Mm-hmm.
Woo, woo, woo,
Right.
woo, woo.
Yeah.
No, they're talking their language
Right. Mhm.
in sound waves, you know?
Yep.
It's just so interesting how all of it has such a connection on this planet, you know, of what level of development they're on.
Yeah, it's incredible.
To succeed. How about ocean, say fish itself?
Sure. So a lot of fish have something called a lateral line organ
Yes.
in the side of their bodies.
I see.
Okay, it's kind of like an organ that just runs right down their side. And they pick up sounds and vibrations through that.
Yeah. It's really interesting because in submarines, you know, and going underwater like
Yeah.
that, how that must change the whole atmosphere for the sailors aboard.
Sure,
You know,
sure.
or whether it's damaging or not.
Well, I mean, the subs, they're pressurized,
Right.
and hopefully they don't lose pressure.
Right. Yes.
But
right.
I think they've got that figured out.
Right. Now, is there any, when you speak of this, what type of insurance? Are we talking about insurance now?
Sure.
That the new insurances people have and things like this with this new Obamacare
Right,
thing.
great question. So we're on just about all the insurances out there.
Okay.
I would say probably about 60% of our patients are able to obtain treatment that's covered 100%
I see.
by their insurance.
Okay.
And that's, you know, things that I'm showing you here.
Yes.
Okay, and you know, a lot of people pay for medications.
Sure.
So some people have to pay for their hearing health care also.
Of course.
You know,
of course.
these are facts of life. But we really try to find solutions that work within people's needs and also their budget.
Well, Dr. Wigan, it's so good to have you on staff here at Downstate to help the myriad of people that come to our clinics and things like this. Might not be for their hearing, but they can be checked for their hearing,
Right.
and maybe live a more active life
Definitely.
as such. So are they going to have any kind of conference here that people might be able to come and get the same kind of information?
Sure. So it's two things. On a monthly basis, we offer the free hearing screening. So we
Oh.
have it this month. We extended it to next month as well.
When you say
Okay.
this month, what month is that?
April. We're in April now, and then we extended it through May.
Okay.
Okay, and we really have. We used to just do it a few months out of the year, but there's such a demand
Right.
that we're really just doing it on a continuing basis.
Oh, that's wonderful.
And we have so many people that are so appreciative because oftentimes, you know, their physicians take a look in the ear, but unless the patient is complaining about something, they're not sending them routinely for a hearing checkup.
You're right, and
So-
I think that any elderly person in these nursing homes, I can imagine how many people sit in nursing homes that look at television but can't hear it.
Right.
You know,
Yeah.
and that's their only company that they
Sure,
have.
sure.
You know, and so these things should almost be taken into nursing homes and set up where they can test that hearing. In fact, I think that churches should be involved in these kind of things because if you can't hear the sermon, there's no sense going to church.
Yeah, we're pretty connected with a number of churches in the
Right.
area, and we invite them to our events.
Right. Well, I tell you, it's been wonderful having you here and have you with the kind of expertise that we really need in communities because so many communities don't have this kind of service. I mean, you know, you look all over the United States, the little places outside in the country, people just get used to what they have, you know,
right.
instead of seeing about it, you know, and seeing things that it's about it. So is there a number they could call maybe if they want to get an
Sure.
appointment?
718-270-3125. 3976.
Okay, well, I just hope that your lines are not burned out, but then I do hope it's burned out because
Right.
people saw the show and they know they can get some kind of help. And if you can't do it here, you certainly can give them referrals.
Of course,
I imagine,
sure.
You know, and because there's so few people trained in these kind of fields, it's not a very attractive field to most people.
It's a shortage profession. It's still considered a shortage profession.
Right,
Yeah.
surely. So thank you so much
Thank you,
for
Dr.
being
Deas.
with us, you know. And to you folks out there, you don't have to do this anymore. You don't have to do this anymore. All these little instruments that you saw right here. Can you imagine something this small can make you enjoy life? To go to theater, to go to a dinner party and laugh when you're supposed to laugh. Not just laugh all the time. But all these little things can make a difference in your life. And when we have things like this for the heart too. I mean, and I think that eventually we're going to have something for that eye, because when I say that we're not at the end of the road of that yet to restore eyesight and things like this. So we want you to have a good time this for your birthdays and for all the holidays and for all the things that you can enjoy by hearing well.